Archaeodeath, walking in the footsteps of past funerals.
Hey!
Good
I was
afternoon
a
or
bit
good
late there.
evening.
How are you?
I'm well. I was trying to use my live studio on desktop, but it wasn't working well.
Well, at least you tried. It's more than I do.
I tried. I tried. It was painful, but I tried. How are you?
I'm all right, thank you. And thank you so much for this opportunity to have a conversation. I do apologise for being a couple of minutes late due to a whole logistics of living involving sequences of actions and material culture. And, this is what archaeology is all about. And I rarely succeed in getting everything on time. It's a,
It's a phenomenon of nature for all of us. By the way, how this is so that's Howard. I'm David, and we've met before, but we've never actually had that introduction. So my name is David.
I was going to ask. So David, we've been sort of playing with the idea of doing a live at various points. It's never really happened, so I really appreciate this. We come from different perspectives and different backgrounds, but we have common interests in mortality. If anyone's, I don't know if people are your followers or mine, and we'll see how it goes. But would you mind introducing your background and expertise so people can get a sense of your angle, so to speak? If there's such a thing as an angle, I don't know if that's the right way of looking at it. But what's your game? What are you after? What do you?
My vibe, my game.
Yeah, the vibe. That's what the youth of today say, isn't it?
My name is David. So I am by training a general surgeon. I do trauma, critical care, and something called acute care surgery, which is emergency surgery. It's all surgical and in the ICU. I'm not an emergency medicine doctor. They're wonderful. That's not what I do. I do a lot of gunshots and car crashes and that sort of thing, as well as other diseases. I also have training, and I'm board certified in general surgery, which is what covers the trauma, critical care, and then palliative care and hospice medicine, something that's a separate board. And I've been doing this for almost 20 years. I was training for another 5 or 6 years before that, and I enjoy it immensely. But death is something that I've always been fascinated by, and how things work, but also how we as human beings deal with it, because we're very different culture to culture, place to place, and really experience to experience.
And I suppose, I feel humbled and very ignorant of the compared with you in terms of the actual reality of dealing with the loss of someone in close proximity. Something that I'm cosseted from, like many people are in society, because in most small scale societies, most of human history, people would have seen people pass away in close proximity without the ability to intervene, without the medical knowledge. And we are in this, despite many people's complaints about the modern world, for all its frustrations, we are at a time that's unique where we have that knowledge to save people, but also to have the best attention people can get in the moments where it's no longer possible to keep going. And that's really eerie, isn't it?
I think it is. I think your perspective. So you say you used a word that I don't agree with, because I think you're more attuned to
correctly,
the
go on.
perspective of death and experience than most people would be, because you've been seeing it happen, not personally for centuries and millennia, but you know the evidence behind what happens in people's lives, and you read that better than most people do. But if you think about it, the difference between the so-called then and now, and I mean centuries or even millennia ago, death was a social event that was expected.
Yes.
Nowadays, and even in the modern era, death is often a medical event.
Yeah.
It's something we try to prevent, not something we accept. Not for everyone, but it's the truth that we do try to prevent it or delay it as long as possible.
I mean, there is a vast cross-disciplinary literature on this, but I suppose if I'm going to crudely soundbite it, we're in a society that sees death as a failure. Someone's giving up. They struggled long. They fought the fight. They lost the fight. I mean, these terms have been critiqued, but they're still in common use, right? We see, even the way we almost. It's horrible. We almost victim blame sort of someone who's in a circumstances completely outside their control, like they're 98 or they're in a car crash aged 8 or something. They weren't driving, and yet we still use language that implies somehow they was not necessarily to blame, but they lost something, they failed at something that other people succeed at. And it's really quite cruel the way the language works, isn't it? I don't know. Maybe that's not. What was the word you disagreed with? Sorry, you have to tell me what I said wrong.
You didn't say anything wrong. I agree with you completely. I think that there's a notion that when someone does die, either they failed in their fight their family failed in supporting them, or the physicians, nurses, and people in the medical community failed in getting them through it, even if they are 99, 100 years old, or even if they are 50 but have had a long fight with whatever disorder or situation they're dealing with.
And I suppose another challenge is that everyone wants a simple snapshot answer, and in many cases, you have to declare a cause of death, but there's many compounding factors, I imagine, and it's not simple. And a simple narrative isn't easy to convey to a family or to friends of the person who's passed on.
And I think that's it's an astute observation, because centuries ago no one spoke about cause of death.
Yeah.
You were either killed by someone or you died of phenomenon. Someone or something. There was no, they were diagnosed with cancer, because even in a couple centuries ago, we had or a few centuries ago, we had notions of what people were suffering from, but we didn't often understand it well enough to know what was going on inside. So we just accepted certain things. They were dying of consumption because they slowly eroded away as their tuberculosis took over their body, or they had terrible rashes and disease and lesions on their skin and soft tissues and plague, and they wind up suffering more and more until they just died. Or they had behavioral disorders that didn't get helped, and their treatment for certain disorders was seeing what happens. And we also observed people at the end of their life, even in the last couple of 100 years, where we would watch their suffering and try to learn from it instead of treating them during that period. So there's a key feature there, that when death is of your own personal interest, that's different than death being interesting from other people's perspectives. Sorry to be worded.
No, that's really interesting. So, there are certain professions that come face to face to death in our society, but death is medicalized. It happens mostly in hospital, even when someone has probably the declaration happens in hospital, even if someone may have actually passed on before that. It cannot be declared. Is that fair? I mean, I don't know. It depends on depending on where you are in the world. But I've had experience of people who've, as far as I can tell, as a non-medical professional, have already gone. There's no coming back from what's happened. But they have to go through. It has to be go through a process, and so we end up having most deaths away from the family home, away from the work landscape, if you like. In thinking, I try to use terms that are a little bit more not modernity, thinking about the fields or the home or the farm or the road, or at sea,
I agree. I think that the thought that there has to be some medical intervention at the end of life is quite frequently what people defer to, but it really does depend on regionality. It depends on experience. It depends on what medical options are available. In the U.S., we definitely have the ability in most states for a paramedic or a paramedic who's on the job to declare someone's death, but it's only under certain circumstances that can happen. If they, I hate to bring up the Princess Bride, but some people are mostly dead and some people are really dead. And the truth is, when somebody's in that situation, it really makes a difference in understanding what, if someone is decapitated, as an example, you can declare them dead in the field, but because they don't make it to the hospital. But in most situations, that's not the case. And there are certain signs that you can look for that tell the declarer that they have died. You'll also hear me say I use the D word all the time. I've been taught in the profession of medicine that we shouldn't use euphemism. You shouldn't use the term passed on, moved on. He's moved to a place. It's very confusing for some families. So even when I say, I'm so sorry, your loved one has died, and they look at you and say, well, so what are we doing next? And you can't say burial. You have to let them understand that this is the end of their life. I see. By the way, you have a rabbi in your.
That's correct. Yes.
Amazing. So, as a person who was raised Jewish, thank you, Rabbi. Rabbis and priests and people who are other clergy do a lot more than people think in the world of dying, because they often are the ones that, number one, let people express themselves at the end of life. They also do something that we talk about in medicine very particularly, especially in palliative care and hospice programs in the U.S., called giving people permission to go on. And sometimes when someone is at the end of their life and they are waiting for something to happen, And they're often, my dad was at the end of his life. He was in a very poor way for about a week. And finally, when one of his oldest friends showed up, he was able to have a very wakeful moment with her, and someone he's known since he was a child, he hadn't seen in years. He was able to have that exchange with her for even just a few minutes. She departed. We all walked her down to the lobby. We came back upstairs and he died because he was waiting for that moment. He needed someone to say to him, it's okay. And he needed some moment in time that he was waiting for to pass before he could do it. That's why some folks die on birthdays or on holidays, because it's a milestone or event for them.
Even, there's this, I'm not saying you're contradicting yourself, but there is an in contradiction, because at one level you say, and forgive me if I'm disrespectful, I'm just trying to get ideas out, but at one level you say, and I think you're right, there is a huge distinction between traditional societies, urban, complex societies, medicalized societies, where death is made into a medical moment. But then we can't escape the social nature. Even when it's in a hospital scenario, we're finding ways. We're constantly trying to adapt. Should we use euphemism? People need it direct? How do we tell people? When do we call it? They were waiting for that moment. It's inherently social, even when we try to make it otherwise. Is that fair to say? I hope that's okay to sort of pitch it that way.
Of course, and the two don't have to be exclusive from one another.
No.
Both true. Death is social, and I will tell you something that we learned a great deal about during, and we've known this before, but something that the societies have learned more after the pandemic was that death is a social phenomenon. And even in hospitals, when someone was dying of SARS-CoV-2 or COVID disease, and they were suffering, and their parents or family or other loved ones couldn't visit them, the nurse was there. The nurse was able to hold their hand and be present for them, so they didn't die alone. And even in this modern world of medicine and other interventions, we talk about dying alone more often than others. He was surrounded by his family. She was with her loved one. I held him when he died. Those phenomenon happen. And the order of things, and I think my point in the medical death is that the order of things is often intervening there, where someone has a diagnosis that leads them down the path towards their own death or their own demise. And they do wind up in a hospice or other palliative care program that allows them to go home or to somewhere other than a hospital. And then they can experience that with their loved ones in an easier way instead of being in the hospital. But it can happen in any location. There's a film that was out a few years ago called Paddleton. Have you seen this, Howard?
No, I haven't.
Paddleton. I think it was I think it was a Netflix film that had some very well-known actors in it, but it kind of went under the radar, and it was focused on, without naming it, the so-called Death with Dignity Act, which exists in some places in the U.S., not all, because my state doesn't have it. But when I trained in Oregon, they had something called the Death with Dignity Act, and this allowed someone who was facing a diagnosis that would lead to their demise within 6 months to be counseled, educated, trained, and then would have the option of, getting their prescription, putting all the capsules into a glass, mixing it with water, drinking it all, and then going to sleep. And then within a couple hours, they were deceased, because it wasn't physician assisted. I don't know if we can say the S word on this.
I'm not sure.
Assisted demise, but
that's not.
It was personal choice directed demise, because someone could decide the time instead of relying on their disorder or their disease to take them. So it makes sense. The movie is done very wonderfully and really pitches the concept that two friends who are very, very close can experience this together and help each other, even if they're not blood relatives, but still able to participate together. I think I've destroyed the description of it, but Paddleton is the movie to see. I'll put it in the chat so people can know what I'm talking about.
Please do. Thank you. And I think, stepping back from the very sensitive topic, which I think should be, a major conversation point, and everyone should be expressing opinions on it, even if they don't have all the facts, even if they don't have, because it should be part of an ongoing societal conversation rather than something seen as taboo, to talk about the assisted processes that people are discussing. I have mixed feelings about it, but equally, I I see the need for this conversation, because at the end of the day, it embodies the very social nature of death, and the agencies involved are quite varied. Your own as a person who may be undergoing that process, whether you have time to prepare or very little time to prepare, whatever the time scale involved is, and then the various family members, friends, and as you say, people of faith who may be there, who may not have known the person for very long, but are there and able to administer some kind of perspective from a faith-based, and that can be really important. But I mean, it's so in the medical world, there's so many ways that language, the spaces, the very interactions with the patient, are socialized about. I mean, even the language, whether we're speaking English, it must be in so many parts of the United States a complex multilingual problem of are they following what's going on? Am I? I don't know. There's so many languages. I mean, in my country, likewise. But there's obviously. I live in Wales. There's Welsh. There's English. But there's also there's Urdu. There's Polish. There's and that must add all manner of other complexities that have to be navigated. Yeah, it's tough.
You raise another fantastic point. At the end of life in the hospital, the requirement is that we communicate with our patients and their families. The requirement also, regulatory requirements demand that we include a medical interpreter in many periods of time, many episodes where we're dealing with someone, and it becomes very impersonal. Now, I may not know a patient very well, but if I was there at the beginning of their hospital stay and I had that conversation with their family saying, they're very ill, this is what's going on, here's what's happening, here's what we're trying to do. And then every day the team gives them an update and keeps them informed. But then a few days later, we realize this patient is going to succumb to the disease. The challenge is we have to then communicate that to them, even though we don't have a personal relationship with them that's long-term. And the ability to convey information can be very challenging when people are not ready for it. We prepare our entire lives to live and then to die, but yet we don't really have that preparation in a good way. We don't do it very well outside of being in a program and the very few that have prepared for it. So I think it's an amazing challenge to face. I think, and if you live in Wales, you have far more languages concentrated in a smaller area than I certainly do.
Yes.
But it happens everywhere.
And it's for me, as an archaeologist, I'm really interested in archaeology. Has a weird relationship with other disciplines. At one level, we feel a bit of an inferiority complex, like we've constantly got to make sure people understand we're relevant, and no, the distant past and deep time stories matter. And at one level, I think with dealing with death and dying, there's no need to big it up. I mean, it's the one constant, and it's the one thing that jumps time, that bridges time. You can time travel whichever way you look at it. If you're coming face to face with a skeleton, whether it's in a museum or in a documentary or in an academic publication, and while there are some parts of the world where those images are heavily censored for respect for indigenous communities, still we are saturated with the archaeological dead. And at one level, coming face to face with those images is a quite benign way of dealing with mortality, because it's not after a car accident or after a shootout or after a long fight with a horrible pernicious disease. It's in the distant past. What's done is done. And it can be a really powerful way, I feel, for people to start to think about those things. Even if they don't have anyone to talk to, they can deal with archaeology as a way in. I don't know if you agree with that. I don't know if you think that's a bit bigging up archaeology's importance in this regard, because at one level, people don't really make that connection. They think, oh, it's just stuff that happened long ago. But I mean, I've always tried to make this argument that we're not frontline emergency workers or medical practitioners, but we're a very strange form of death dealer ourselves. We are mediating with Egyptian mummies, prehistoric cremations, Roman tombstones, medieval sarcophagi, 19th century, crematoria, or early 20th century. All of these are ways in which we can, through the heritage, the historic environment, we can get people thinking and engaging with mortality. But I'd love to hear what you think about that statement.
So, well, I will tell you, as a fan of the archaeological world, and I studied anthropology in my university years as well. There's something very different about the study of archaeology with what modern death can present in the future. Archaeologists that will exist in, say, 1,000 years will often have no idea, based on the archaeological record of our death, of our dead, what happens to them, because they'll be embalmed. They often will be have items preserved on them. They won't have things removed. Our ritual of death, sometime our current modern ritual of death in, say, I will dare use the word civilized areas of the world. Those rites of death, or those processes, change the way our bodies will present evidence in the future. So archaeologists have the very difficult job of interpreting what death was like for them, and can make that leap from the diagnosis of what happened, and I use the word diagnosis with intention, the diagnosis of what happened leading up to someone's death, whether it's a poorly healed fracture or something that happened to that person peri-death when they're in their 30s or 40s centuries ago, versus seeing someone who is elderly now, who may have a large tumor, but maybe 100 years old when they die of something that's very different. I think we're able to understand that people today can die of disorders and diseases and situations that may be or may not be related to their overall health. And it challenges all of us to understand that. But archaeologists give us the sense of purity and pure looking at the evidence behind what scholarly activity really can tell us about medicine. I often, see that my presentations on TikTok are often about what modern medicine uses as evidence to learn how to deal with disease. The problem is we have thousands of patients that are on the record that show us what they've had, and we study them. Archaeology deals with, it's never anecdotal, it's always evidence-based, but it takes a long time to get all that data compiled into one place and really interpret it. So
we never have certainties with archaeology, because, and we certainly often don't even know, we can't diagnose what killed someone. We have obviously cases of violent death, and we can make strong estimates, but never to the levels of certainty demanded in a coroner, or by a coroner, or a kind of a modern scenario. But what we can do is we can explore the history of, we can see people who've survived illnesses and diseases. We can look at their life history, or written on their bones, of their diet, and their with chemical techniques analysis. We can look at stable isotopes, see where they lived, and where, and as well as what they ate and where they traveled from. There's so much we can learn, but also we can learn about the funerary practices, about because for me, a lot of those funerary practices are in societies that may have not have conceived of the person as fully dead yet. And death is a social journey, and it's a transition. And within various different religious traditions, the pace can vary, but we are looking at a process that was widely understood needed to happen in a particular choreographed way in order to make the dead, to create the ancestor, to create the body. I was just listening to a talk at a conference last week about the LBK, the linear band ceramic, which is a German term for the earliest farmers north of the Alps, from a swathe from the Carpathian Basin to the Paris Basin, so that whole Central European area. And this is a culture that lasts about 2,000 years, and they're living in long houses, and they're farmers. They're the first farmers. They're keeping, when I say farmers, it's the Southwest Asian package of sheep, goat, pig, cow, barley, wheat, like various lentils, pulses, and so on. And they're almost exclusively buried in the same position, in a very careful position. And the archaeologist, who's a doctoral researcher, was saying, oh, this is really, repetitive, boring practice. And I'm being unfair. She didn't say it like that. She knows exactly what she's talking about, but for purposes here, she's talking about how regular, about 97% of burials are in exactly the same fashion. And I said, this is long before, this is thousands of years before any attested modern surviving world religion. And yet you've got a society that lasts for, what would 1,000 years be in terms of generations? Who knows? But, for many, many generations, for dozens upon dozens of generations, over a vast swathe of Europe. And they have a very specific conception of how to appropriately bury the dead. And then there are exceptions. We've got some evidence that they were very violent There wasn't a lovely, peaceful, happy farmers. They were butchering each other like nutters on some occasions. We've got one side at Herxheim where we've got the ditches just packed full of mutilated bodies, and looks like there was a sort of, there's been arguments that this could be some kind of ritual cannibalism or ritual dismemberment, but it looks pretty violent to me. But my point is that's exceptional, and so there were people that were denied those traditional rights. But it speaks of, and that's the story archaeology can bring. It can bring deep time patterns. We can't always work out. We don't know the names. We don't know the exact circumstances of what mixture of diseases made someone die, but we can look at broad patterns, and that, I think, is a really powerful thing that we can bring that no other discipline can. And we're looking back thousands of years before written records to do so, and we don't always have the answers, but we are providing those insights.
That's fascinating. I think I know some of the sites. That's Talheim and Schlitz-Aspern. That's in Germany, and
yeah,
I've read on them because those are places that I'd like to go someday and see.
Oh, fantastic.
But there's a challenge there, because if we look at mass graves today and we assume that something was wrong in a society, as opposed to seeing what may have happened as a regular phenomenon. So perhaps there was a ritual fight that would occur and that would cause this to happen. And then Herxheim is the one where the evidence was of cannibalism and disarticulated bones and cut marks, which if we start today, we would assume serial killer, ritualistic death, all these things. Which may be. But back then, we try to explain it in very social ways as opposed to mental disorders or other things, phenomena. I think it's fascinating.
I mean, it's just, I suppose the frustration of archaeology is everyone has a buy-in, everyone has a way in. It's such a personal thing. And I think what I've heard some archaeologists say, and I've used this argument a few times, and it rings hollow, is, oh, well, it's old death is safe death. And I'm not sure, because it doesn't have to be well preserved. It doesn't have to be fleshed. But even just encountering, I've been on archaeological sites where we have found no human remains. We're digging settlements. We know the burials are going to be far away, and we come across one, and just the whole mood, no one's laughing and joking. You make jokes to sort of cope with it, but even in an archaeological context, it's long ago, but it affects people. Even when it's fragile, poorly preserved flecks of human remains, it's never without some impact on the archaeologists and any audiences coming to visit, and it can be a provoker of conversations about people's personal experiences, and I think it can be a very sort of, I wouldn't say it's necessarily healing, but it can be a way of at least getting people in dialogue. I don't know.
So you just said something that sparked a very important concept in me. So when we see archaeologists, are everything they deal with when it comes to human remains is about someone who's died, and whether it's violent or not. And the nature of some of those deaths is very young, because life expectancy was not very high and many years ago. But the question I have for you is, do archaeologists get trained on something called trauma-informed education or trauma-informed?
No, they don't. I don't work in the commercial sector, and I know that there have been archaeologists who work on, what's the best way of putting it? Recent 19th, 20th century remains, either mass graves, war graves, smallpox victims, cholera cemeteries, things where not only are they having to put on a full hazmat gear, but also they're having to deal with fleshed remains, pretty soupy type stuff. And that is, I think there have been occasions where they've embedded in the project that this is going to need a rapid turnover of staff. This is going to need lots of extra psychological support, but I don't think it's really properly tackled I talk to my students about these things, and when we're even in the classroom, it inevitably comes up that someone's had a loved one that's passed away, or they remember an incident from 20 years ago. Despite using modern parlance, it's a very triggering topic, and I've been in a class where students have just had to leave, not because I've done anything particularly gratuitous, but the topic is not, they thought they were okay, and it's just not working out for them, including Gulf War veterans, helicopter pilots, not just people that deal with or are dealing with a family member with a disease. We're talking about, we can talk about some quite harrowing stuff. And so archaeology isn't a safe space, as some people try to pretend it. It's not. It was long ago. We're dealing with long dead people who died in. But when it's dealing with things like where we can connect the circumstances of death, we can connect to. We can see that person was hit by a bladed instrument. That happens today. We can see that person died of a particular disease that's still prevalent in parts of the developing world. That happens today. It's very difficult to pretend that that time jump it creates a safe space that it's all right. It happened long ago. It still can be very powerful and profound for people.
I don't think there's any exception from that, because there's certainly. You've been to the States?
I have I can't remember how many times, 5 times for brief visits. Yeah,
I don't
6
know what
times.
the training sites are in the UK, because I just don't know, because I'm naive to that. But
No,
the University of Tennessee has the body farm.
Of course, I've heard of it.
I've gotten a tour. It's frightening but amazing. But
wow.
The thing that I'm fascinated by is when we talk about being trauma informed or teaching people trauma informed, we usually talk about victims of violence. We talk about people who've been exposed to victim of violence. And this means military, personal, community, etc., and the families of those people and people who've investigated it. So trauma surgeons see this, nursing staff see this, people who are in that field see it. But for us, and I mean the global us in the medical profession, this is trauma that we see fresh in front of us that may trigger something from our backgrounds or our childhoods, as opposed to in the archaeologist community, where these people who have studied this phenomenon for so long and all their lives can still be triggered, and you can still have that trauma. And I want everyone on this live, all 15 people, to understand that the possibility of being triggered by something doesn't matter how old something is, how long ago it was, or what phenomenon it was. Someone could have died from natural death, but seeing that in the re-emergence of their experience by looking at their record is important to recognize as a trigger, and it's possible.
Exactly. And I think one of the other things that I don't know how to put this. I'm not saying you, but people generally forget about the archaeological record is when they think of death, they think of adults dying. And, the archaeological record is ram-packed full of sub-adults right the way down to perinatal, and that can be quite harrowing to people when you're digging or you're talking about a site. And I go, oh, and here's a 6-year-old, and here's a 15-year-old, or here's a 1-year-old, or here's a 2-month fetus, and it's really, that is, I think, one of the things that the students of the subject, whether it's in the field or in the classroom, it can be quite a surprise to them how that affects them, because we're at one level, we're at a society where there is an expectation that we will reach some kind of age. That we will grow up before we die, and unfortunately, just while the cliches of everyone lived to the age of 14 or some silly stats people come out with, no, of course not. If you got through the first few years, you'll be probably okay. Well, not okay, but you're going to keep going. And we have the osteological problem that we can't age people over the age of 45. So there's also the bias that we don't see old people. So there has been a bit of people have reacted too far the other way and said everyone's dying literally before they've even sort of, no. But there still would have been a lot of infant and child death. And that is seen in the archaeological record of almost every society, and particularly urban societies. Even whether we're talking about Romans or we're talking about the 19th century, towns are not good places for anyone. They're supposed to be better now, I believe. But my point is, towns are where people go to get horrible things and die. And they only survive because of a flow of people from the countryside through the ancient world, Middle Ages, right up to recent centuries. So and children, it's that, I think that hits people a lot, is that they know it but they kind of forget it, if you know what I mean. It's kind of it always surprises people, the amount of child burials or flecks of bone that probably were another infant but their remains haven't survived, buried in a shallow grave over an earlier body, and you come across that stuff and it's just wow, it can build up a cumulative effect on people.
That's amazing. And we remember pregnancy loss this in modern times is between 10 and 20% in most countries, and that's most civilized countries, people with first world medicine available. So
Yeah.
have all this preventative care. In other times, it was not present. So we assume that people didn't. We don't see that as often in the reported record, in the commercial record, in the museums. We don't see it.
No, and this is the problem with, I think, when we think about how archaeology is consumed in popular culture. Um, I think we benefit from a lot of high-profile TV shows, at least in Britain. There's some pretty crap ones in the States, and there's a particular issue with the States and having just pseudo archaeology is the mainstream, right? And it's very rare you get any documentary that doesn't have some outlandish claim about aliens or pyramids. But my point is, in at least in the British popular culture now, archaeology and the fact that sometimes, not always, but sometimes we deal with the dead is pretty established. It's pretty established. But the problem is we often fixate on exceptionally rich burials, burials that are treated as typical, but actually were probably very exceptional at the time. And I think there is and this is true of museums, we kind of pick some of the more celebrity burials or graves or tombs, and we forget that actually there's a lot more to it than that. And it's part of the story of archaeology is getting beyond just a kind of, it's like trying to trying to capture our society and say that the careers of Kim Kardashian and Justin Timberlake or whoever are somehow representative of early 21st century culture. But yet we, at least in popular culture, we do that with the dead. We pick celebrity examples of and treat them as normal. And partly people do that because they want to be in the past. They like the idea of living in the past, but they don't want to be poor. They want to be the 0.001% who actually lived a long, fruitful life with lots of servants or enslaved people doing everything, all the real work. And people like to think of that. That's why I have so many people in my comment section. I am descended from Ragnar Lothbrok, or I'm descended from Alfred the Great or Charlemagne. And it sounds cool, but the reality, that doesn't mean jack. I mean, in reality, most of us, our ancestors lived hard, short, and rather wretched lives. And but we like the idea, and that's one of the things I have problems with archaeology, is that we professionals have bought into that a little bit too much, this idea that look, we can look at some cool exceptional graves but it's really in the big patterns where archaeology, I feel, makes the real contribution, not in the story of individuals. I mean, yes, we can get some snapshots of individuals, and those are part of the mix, but you know what I mean, it's the museum display that they have room for two skeletons, and you go, okay, the Viking Age or the Middle Ages, and there's two skeletons, and you think, well, how is that working when they've excavated? I mean, I don't know, for the medieval Britain, I'm making this figure up, there must be hundreds of thousands of excavated skeletons now. And when I say excavated, I don't want to give people in this live the impression we're just gleefully digging up the dead for a laugh. This is ahead of development, ahead of sanctioned projects that are going to the burials would be destroyed if we didn't record them. It's called preservation by record. So we're doing our best to respect remains that would otherwise be destroyed. So yeah, it's that big story we can tell that I think is of the population level that I think's perhaps less sexy, but it's actually what we do, rather than just go, oh look, I wonder how they died. Let's reconstruct their face, which happens a lot, and can be a very important educational process. But yeah, I'm ranting now.
It's also extremely invasive. It's that phenomenon, the fact that we sanitize, sensationalize, and exotify the death of people that came before us, no matter when it was. Shows. I know what you're saying when you talk about TV in the U.S. because the media, it's bones. We can reconstruct somebody's image perfectly from remains from 20 years ago, maybe, but that's for crime solving. Everything about archaeology that's on the modern media is about, let's solve this puzzle and get a treasure. Let's figure out who this person was and who their lineage. It's all those things that we see. And I, by the way, one of my favorite things that you talk about is these people who claim to understand and I'll use the phrase, very bad Viking culture, and
Oh yeah.
claim it as their own, but you correct them. And I think that that's an important part of what you do, because you make people understand that using a term like that may not be as accurate as anyone thinks. And
Yeah.
it's like in medicine, we have to explain things to folks that, oh, I had robotic surgery, so there was no surgeon involved. Robotic surgery is a tool. It's not the surgeon. It's not the surgeon. It doesn't do the surgery. It helps the surgery. I think people have a harder time understanding the past than they do the present. So I think your experience and your role is much more difficult.
I think it's really challenging because, as I don't know if I finished my thought when I rambled off on something else, but I was going to say is that the public demand a lot of us. They want to, and they do this of historians too. They and with CGI and AI ability to almost create these immersive environments, video games, people almost expect us to be able to go, well, what's here? Well, I can see a bit of a tibia here sticking out of a trench. Let's do a reconstruction. He lived to the age of this. He was a potter, but then he changed and became a leather worker, and he had a bad leg. And of course, his hair was blonde, and he spoke with a southern accent, and all this, and he probably was called Brian or something. And you go, whoa! We can't do all that. We can't do all that. Well, sometimes we can. Sometimes we can match to historical records. Sometimes we can match with DNA. Now we can start to make estimates of hair color and eye color, and there's so much cool that's going on. But people want that certainty, and that certainty can be, our undoing sometimes, because often, and when I talk to the media a lot, I don't get on TV a lot because I usually destroy my chances, and I'm quite proud of it by going, well, no, that's not the interesting question. Here's what's the interesting question. And they're not interested in the actual question. They're interested in their pop question of what, well, what did they live like? And what do they, I said, well, we don't know, but what we can say is this. And they're never interested in what we can say. So we always have to be data led. We can't just sort of live in the land of fantasy. We have to sort of root it in what the evidence is telling us. And sometimes we just simply can't answer the questions that the public want. So I suppose the challenge, that's the curse, the blessing and the curse simultaneously of archaeology, is we can bring the dead to life. We can bring that link to people who lived in the last ice age, people who lived in, in the Bronze Age, and the people who lived in medieval Europe, or people, and we can, tell the story of different species that aren't even here anymore. Homo luzonensis, floriensis, Neanderthal, Longi, Denisovans or Denisovans, or everyone seems to say it differently. I don't know, but those lot, we can do that exciting, cool stuff. But people then want to know, yeah, and what did they have for breakfast on a Sunday? And you go, I don't know. It's that we can't answer everything. But there is a constructive overlap with forensic studies, but often the forensic, the facial reconstruction thing drives me a little nutty though, because at one level it's a really great way of capturing, rebuilding from the skeleton in an informed way, and it is science, and it's art meets science, in terms of it has to be creative, it has to be informed speculation about skin texture and tone and blemishes, and but still it's really good, and it gets people connected to a face from the past. But sometimes I just go, why they all end up looking like the same archaeologist I happen to know? And I do have a suspicion that there was a period of time where they all ended up looking the same, and they all had the same beard, and they all had the same. And I thought, hang on, is this a running joke? Is this anyway? Sorry, I find these, there's still errors and there's still nonsense sometimes in our field. So I don't know.
I think that's the same in all fields, though, and I think that's where people forget, is that that science is science, but there's an artistic approach to it, or there's an artistry to it. That yes, we have to rely on facts, but the interpretation is still left to the art of the expert, so to speak.
Yeah.
Your comment about forensics learning from archaeology, I think without archaeology, we wouldn't have forensic criminology or forensic science, because the nature of the beast is to investigate. The challenge is that in forensics, and I have something to do with forensics because I'm often asked to testify in court about injuries for bullet wounds or stab wounds, and those are fascinating to discuss as an expert or as this and that. But I think the challenge is it helps the forensic scientists understand the criminology or the event that happened that led to someone's injury or death when they can't speak for themselves. And I think there's the parallel. The challenge is we rely on something that has been hastily collected, not preserved well, because our evidence collection process in most of the world is not nearly as refined or as cautious and careful as the archaeologist approach would be. So we can learn something from that.
Well, I mean, I haven't worked with forensics, but I've had conversations with forensic archaeologists, experts who cross over, and they talk about how very recently, only very recently, and it's particularly pioneered in the States and to some extent the UK, have crime scenes taken on some basic archaeological techniques, like the way I was trained to excavate a site. Some basic, just standard untrained policemen just walking through, picking crap up, when digging in basements, but without an archaeological methodology. And we had some very famous mass murderers in the UK where the vital evidence, they were still convicted because there were so many strands of evidence, but the vital evidence was lost for identifying some of the victims because there was no systematic excavation of the same burial site where multiple victims had been interred. And so it's not just about the prosecution, it's about the families, and so archaeology has really sort of helped to slow down the technique, slow down the process, rigorous systematic excavation and analysis, as well as the science, the lab stuff, as well as the DNA, as well as the having the specialists who experts in particular kinds of materials. I was just had an email exchange, I don't know very well, with one of the leading experts in jewelry identification. So she gets involved in, as a forensic archaeologist, in identifying jewelry found with victims' bodies and where they're. So she actually does the artifacts linked to the, so that she can say, well, this is a mass-produced, shot. This is a high street shot piece of jewelry. It could be from, but here are the main suppliers. Or this is a really unique 19th century. Only a select number were found, and that can really help to identify people by knowing obviously about the objects. It's not just the bodies. So. So many specialists can get involved, but I mean, I can't imagine how the pressure on you having to appear, and every slight phrase you use about any particular situation is read in different ways. Shall we say that must be very very stressful?
Yeah, it's for me, it's not stressful at all because I think the same is for you, and to a degree, because you get to state facts. But the interpretation of the fact is left to somebody else's desire to a degree. I think the interesting part of what you just mentioned, though, is if you think about right now, if I can go on, for instance, the website Etsy and purchase a turquoise and silver piece of jewelry from the Ukraine, and I can order it, and in 6 weeks it's in my hands, and I die with that someday, and someone finds it and says, ooh, let's date this and find out where, they're going to say this is a Ukrainian man who moved to the U.S. No, it's not the same, because we're so much more portable in what we have, and our the stretch of air travel allows us to do different things. So I don't envy the job of your future, your descendants, so to speak, in ancestry and archaeology, because they're going to have a lot less clean a record to a degree, but they'll also have much more amazing tools to use for it.
And at one level, I think that will be wowed by the next generation of new techniques and new both of excavation and analysis. And I can't even begin to. I thought my now passed away colleague, he said to me once, we'll all be using nano robots to excavate. We won't even need to move the earth in the future. And I thought, yes, silly old fart. And I thought, well, it may not be wrong actually. That there may be, we've got so much more refined, non-intrusive methods. There may be other ways of getting at our information without having to dig at all. And I think that is a very constructive, and the ways we can sort of the kind of questions we can ask are going to change. We've already seen a shift towards questions about restorative justice, about preservation and connection to communities that have been disenfranchised of their histories. We're going to see more sort of research that tries to tackle questions of societal needs, particularly when we see people realizing that written sources are not being preserved. are not necessarily telling us the things we want to know. And I think archaeology as a discipline, whether it's called archaeology, because I think the term itself has got problems, and whether it's seen under an umbrella of anthropology, whether it's seen as sociology, yeah, there is, as someone said in the chat, there's a huge colonial bias still in archaeology. I think we're going to move in a constructive way. I mean, people have been saying this for decades, but I think archaeology has still a long way to go to shift the kind of questions we should be asking and what we can find out, away from let's just compile lots of data, to let's try and work out the stories and not only the gaps in the historical record, but new kinds of question about the human past. Yeah. Anyway, I just find it fascinating. I mean, so do you have to I mean, have you been to many archaeological sites in your own travels, in your own time, so to speak? It sounds like you've got a real enthusiasm for it.
I have an enthusiasm, but I'm not allowed to go to them for the most part. I can go and look at them from afar, but you can. I know that the possibility of going to participate in a dig that is ongoing is there, but I don't want to be a tourist. And this is the same as me saying to an archaeologist, saying to you, Howard, have you ever been in an operating room and seen what's going on in the OR? I think that
only when I was asleep.
Right, and I think that phenomenon means that the two may cross over. But if I want to be a tourist somewhere, I don't want to be a tourist. I want to either go and learn and experience what's there and have it not just augment, but advance my understanding of what findings in a surgical approach would be. But we've learned things from the past, and I'll give you one example. It's colonial U.S., it's Revolutionary War U.S., but it's not that old. We learned technique from, for instance, amputation. We do something called guillotine amputation when time is of the essence. And in the setting of Revolutionary U.S., Civil War, really, the concept of an amputation was happening because someone was shot in the foot. They were treated with wound care, and their bleeding was stopped. But then they would wind up with a foot that had infection or necrosis or gangrene, and that gangrene would spread because it was mostly wet gangrene. And these people would, wind up with severe infections. So instead, the thing to do was amputate. Well, this is also pre-anesthesia. So it was a leather strap and a knife and saw. And actually behind me, give me a moment, I'll bring it over here.
Yeah.
I have an amputation blade. Somebody also call it an autopsy blade. That is a very.
Be careful of TikTok; they may ban us for this.
Sorry.
Yeah.
I'll show you. It's the handle. It looks like any other KNIFE. It's just sharp, but this is about 130 years old. But the concept is that this device was used quickly, and we used to use chainsaw, not a chainsaw as in the powered one, but a loop chainsaw. You'd go back and forth, or just saw across a limb as fast as possible, because then you control the bleeding, put a dressing on the stump, and you do it as fast as you can. We do that today when time is of the essence and someone has a severe infection, but we only do that a couple days before. Don't just leave them that way. Then we formalize it later. So I think we've learned some things from what we see and what we know, but a lot of that is the written record as opposed to an archaeological record. When we see amputations from millennia ago or someone missing a limb, it's usually because it was either bitten off or torn off, or it was cut off by someone in war or in battle or in some sort of argument or in injury, and we rely on just wondering what happened, how they survived without it, or if they didn't.
I just want to make it clear that I study the past. I don't want to go back there. It sounds blimmin' horrible. and likewise, I like the dead, long dead, rather than all this fleshy, gooey, gangreney stuff. You can keep that. Thank you very much. I don't. I'm happy to be called soft and disconnected. But I don't want it. I don't want it. No, thank you very much. No, but seriously, I'm being silly. But I mean, it is. There is. I know that I haven't studied up on it, but there are quite a lot of studies now of in American historic period cemeteries of being able to actually see in a standard cemetery population not only the diseases and the degenerative disease effects on the bone, but also gunshot wounds, the prevalence. So the famous and controversial African cemetery in in New York that was a whole controversial thing. There were multiple individuals within a relatively, I mean, it's big in archaeological terms, but it's not that big. There's multiple individuals with gunshot wounds, and we have an archaeological record of gunshot wounds now that shows the nature of that technology and the way it impacted on at a societal level. I mean, I know we got the stats in the news daily and stuff like that, but what I mean is that this gives a veracity, a physical record that complements and adds detail to the accounts of the historical record, which may only have something like shot, on this day and buried in these kind of really sort of Western cemeteries you've got, where I know they've restored them mainly, but they have very specifically biographical things like, fell off his horse, and all these kind of, but you also have, but that archaeological detail of being able to analyze those bodies allows us to understand and inform society about ongoing causes of death that could be preventable.
I completely agree. And we learn more and more, especially with advancing technology. So, and I mean technology in the loosest word, because firearms have advanced over the centuries. We used to have musket balls that were very large that would be at a moderate velocity. Now we see very high-powered long distance rifles that can cause disaster. So one of your followers, Ryan McManus, just mentioned that Incan brain surgeons were a higher survival rate than Civil War brain surgeons. That is true when it comes to some of the record that we have out there. But Incan surgeons, people who operated on the skull, were doing one procedure, and it was trepanation, where they made an actual hole.
Yeah. We've got to put it in context. They weren't doing like the kind of, I think it's really important. Yeah.
In the Civil War, we were doing trephaning, where we would make small holes, remove pieces of skull, and then we would do craniotomy. So we were adventuring into a lot more during the Civil War. Now, that said, they were cautious in the Incan world, and I think the Civil War, we were uncautious or incautious. And that's an important phenomenon. Bone healing is what really taught us this information, and it's fascinating to see. So we still do trepanation with burr holes now in some patients. So it still happens to this day.
I mean, it's really interesting, the conversations that are being had between archaeologists and modern day society. And I do want to flag up before I forget that there's been a long-running series of projects run by Professor Karina Croucher at the University of Bradford, and she's worked with palliative care professionals and other medical professionals. I'm not sure she worked with surgeons, but she did this project that was about death cafes and basically bringing people who have been bereaved or are involved as professionals in dealing with the dying and the dead into conversation with archaeological evidence. My criticism of her project is not a criticism of anything she did. It's more what she didn't do. And I respect why she didn't, is she kept it in a neutral environment. Whereas for me, the power, and this is where TikTok and other video media can provide, is I can take you to cemeteries. I can actually take you digitally, or I could do tours, but I don't have the time. But I can take people to museums. I can show people the remains. They were looking at photographs and discussing, issues linking past and present in a project that was about trying to think about how archaeology can help people today, provide perspective, insight into dying, death, and bereavement. But I think a lot of the power of archaeology is places, is things, is connecting people to that stuff. I don't know what you think about that, but I just wanted to flag up Karina's work, which I think is really important. But equally, I think there's more we could be doing there.
I've read some of her work, and the concept of exposing people who are experiencing death through their loved ones, etc. It's not saturation, it's not immersion therapy, but it could be. I agree with you that having that exposure is important. I think everyone has the experience of when someone dies, a loved one is gone, and they go to the cemetery in modern day, and and we see this in media as well. The lowering of the casket into the ground, or the final moments, tend to be the times where people are most experiencing emotion, because it means to them the end, even though the end may have been days before. I think her approach to, I think the description I found, I just looked up notes of mine. She combines deep expertise in Neolithic mortuary archaeology with contemporary psychology. Brilliant concept, but I think there's more. And your comment about surgeons, it's because surgeons don't often, well, I won't make a blanket statement, but many surgeons don't associate their experience with the death of the patient. They are often the technologist. It's not every time, but it's a lot, instead of being participatory in it. My background is that I worked in organ donation for a few years before I went off to med school, and I'm fascinated with that concept. So I really wanted to make sure that I was holistic in my approach. So having trauma, critical care, and then palliative care means that I have the triangular or the footstool of life, death, and everything in between. And I'm a believer in that. So I like that people study this, especially from the academic perspective and from the living and dying perspective. But I don't think we'll ever know enough about what people's experiences are with death.
I have a doctoral researcher who's she comes from an education background and a sociology background before that, but she's doing her PhD. I inherited her in the sense that death got in the way. Her supervisors got ill and passed away, and so I am the next. So I'm marked now because almost everyone who's supervisor seems to have. But if I'm cursed, I'm cursed in so many angles. I'm associated with death. You know, I obviously I'm not superstitious in this regard. I do believe my faith is that computers are out to get me. They're out to screw up my day in one way or another. So I'm not totally atheistical, but I do believe that computers are out to find a way to screw up my routine in some way. With why isn't it working? It did that when I pressed the right. It's never me. It's them. I'm a blame culture. I've got a very sort of primitive, superstitious way of thinking about computers. But I think that's just because. Anyway, sorry, I'm going off.
Not superstitious, and be careful. They're listening.
I love computers, especially mobile phones, or as they say in the States, cell phones. Because you've got to use the keywords so they know you're being nice about them. I love them. There you are. No, but seriously, we have this whole issue of how we're able to have these conversations, and for me, it's really interesting that you seem to be so familiar with these issues, but we don't often get a chance to have these cross-fertilization of dialogues, and I certainly don't. So I was talking about my PhD student. So I inherited her as a kind of, I knew about her. She's an individual in my institution, so I'm supervising her as a person within my own organization, but not from obviously there's no conflict of interest. She's from a different area, but she's from education. But her thesis is looking at the material cultures of that are inherited and what people do with them. So she's interested in heirlooms. She's interested in inherited items and the guilt and the comfort they bring. So they're not just, people have very different opinions about items returned from the crematoria, such as prosthetics, or some of them donate them, others keep them but don't really know what to do with them, and they're in a drawer for years, or their favorite brooch, and she's doing a study by interview of dozens of people that she met through a recycling Facebook group. So it's from her area. So they're people interested in house clearance, removing recycling things. And so she asked them all, how did you deal with Aunt Betty's wardrobe? How did you deal with your grandfather Fred's collection of model trains? And which items get selected as mementos, and which ones, what are the choices they make about how they redistribute those objects? And it's a fascinating insight into how material culture is so important to us, even though we say, oh, it's not. It is. I've got an item of my grandfather's, and it's a very mundane item because all the other stuff my dad still got, but I've got his comb. It's just a basic plastic comb, but it's his comb, and I've got his comb. And that's because it's very interesting, because I actually study combs in early Anglo-Saxon period graves, and I think that everyone says, oh, they're just personal items. Well, they are personal items, but they're not just like a tool. People's combs not everyone, can be in some societies really important markers of not only what you do by grooming yourself, but also maybe other people groomed each other. We think of grooming each other as something chimps do, but we don't think that human societies. There's so many records of of societies where social relations between sisters and brothers or mothers and daughters is mediated by hair. And so I think, these are the items that mean so much to people. So it's not just about bodies, it's about things too.
There's it's funny you say about mementos and heirlooms. We had there's a podcaster who is she's a published podcaster. Her name is Chion Wolf. She's on this platform as well, and I hope she sees this. Chion is her name, Chion Wolf, and she's from the U.S. She lives down not enough too far from me. She has a program on public radio here called Audacious, and for their 5th anniversary of the show, the program, it's an award-winning program. She does a wonderful job. She interviews fascinating, experienced people in very unusual ways. People who are dying, people who are having other experiences of their lives. But she had a 5th anniversary party or a gathering, and people brought heirlooms. And one person actually brought, I believe it was a prosthetic or it was a brace that her great aunt wore, and she still wears it once in a while when she wants to remember her loved one, which I was fascinated by. But
wow,
I've seen this in museums talking about these tortoise or gold combs that I see. I think to myself, Howard, if you said your grandfather?
yes.
If your grandfather was a woman, if it was a woman in your past, perhaps it would have been an ornamented, fancy comb as opposed to just a simple plastic, my mustache comb.
Yes.
It's fascinating.
Yes, and it's also the individual micro family politics of who gets what and which objects get dumped, because everyone loved them, but no one can decide who can get them. So there's some objects that are sort of sitting, people are trying to avoid conflict, and some people are stoking conflict, and it's not always monetary. It's about So yeah, I find this a fascinating. So I think her project, if she can keep going it, where she does a full-time job and tries to do this PhD, and if she gets it done, I don't mean that in any. She's a lovely lady and she'll do really well. But if it's going to really be insightful, because there's been sociologists that have done this kind of thing. But I think coming with a bit of an archaeology angle, looking at the detail of the material culture, is going to be very, very interesting.
It's funny you say that, because I thought you were going to say that she may not get it done before you're gone.
Well, exactly. Well, I've already recorded. No, I haven't. I said I need to record some posthumous TikToks, but basically AI will do that for me, won't it? Deathlinks. It's archaeology professor Howard Williams here in like 2120. People no. But seriously, I do think I mean, death affects us all, and the problem with studying death is that though it's very hands off, I don't know when it will become too all-consuming. But I have archaeology takes many different forms, and I do other things as well as bodies. And I'm not someone who actually does analysis of skeletal remains, so I have basic training in that, but I couldn't be employed, and I don't regularly, I'm not called to excavate skeletons. So I've excavated only a handful in my entire career, because that's not the way I approach it. I deal with other people's data, and there's an ethics thing too. Is I don't want to dig up stuff just for the sake of digging up stuff when there's existing data we can use. So actually, I'm quite hands off. But I've got to keep adaptable to what. Sometimes I've been working on projects, so I thought, I need to give this a break. This is a bit grim, but most of the time it's fine.
I think we're similar that way, because most of my research is on injury prevention and modern injury prevention. And one of my fascinations is the rendering of first aid that's been in the archaeological record. So I've looked a few things up, but perhaps we can do that next time. If we do this, that would be kind of cool. There's a few things out there in the world. We see healed bones in the archaeological record in the Neanderthal and Paleolithic. I know that exists. I think Ryan's comment about trepanation is very important, because we see this not just in comprehensive care, but first aid. Who renders what at the side of the patient? Do we see bandages and splints put on in a grave because they had a recent injury that they didn't survive from, but someone rendered aid to them? I'm fascinated by that. So, and Howard, respectfully, it's 3:15. I have to be somewhere at 3:30.
No, that's absolutely fine. I was going to say, this is a good schedule. This is a good duration, I think, for my brain capability. And I think this is probably, so I just want to say, we'll do this again then, David. That's really, really good fun. We didn't exactly script it. We've talked about so many issues, and I don't think they're necessarily in the order that makes any sense to anyone else. But I think I certainly appreciated what you were saying, and I think it was a really great conversation. So that's what it's all about. So just want to thank everyone who joined, and thank you, David. And the final question I didn't really articulate very well is: would you be happy with me downloading this and putting it on my YouTube, or do you think that's not? You're all right with that?
Absolutely, okay. Sure. Yeah, as long as you're comfortable with it, I'm happy with that.
Yeah, that's great, because I mean, I get hardly any views on YouTube. It's not about that, but it's about, this is a great record of a constructive conversation where we're discussing a range of things. And people, if someone finds it interesting, a student or someone who's just joining this field or fields, then that's all the better. But thank you. Then I will do that. I'll send you a link, and when it's up and running. But thank you so much for this evening.
With this comment is that a couple years ago, when I first joined TikTok, you were one of the first people I ever saw on TikTok, and I was
so sorry.
I remember that back then. But I actually own a book that you published, because I found it literally at a garage sale. And I will show it I have to find it in my stacks, but it was wonderful. And I just appreciate you letting me come in today. And remember, you mentioned YouTube. Well, so the future of digital forensics is really digital archaeology. So
yes, exactly. I'm a garden sale archaeologist. This is the way. This is my future. Is that I found my own book in a second-hand shop, and I go, I'm having that.
Excellent. Thank you again.
Take care, mate. Really good. Cheers. Bye now.
So much.
If you've enjoyed this Archaeodeath video, why not check out the Archaeodeath blog at howardwilliamsblog.wordpress.com.